Hey guys, welcome back to my channel. I am Mila Clark Buckley, the Hangry Woman, and today we are talking about all of the medications I take to manage diabetes. If you're new to my channel and you don't know, I have what's called latent autoimmune diabetes in adults, which is a slow progressing form of type 1 diabetes. It's initially sometimes diagnosed as type 2 diabetes without confirmation of antibody tests, and so that's what happened to me. I lived for 4 years thinking I had type 2 diabetes, when in reality I actually had the antibodies that cause your body to attack its insulin producing beta cells and therefore creates an autoimmune response, which results in type 1 diabetes. For me, type 1 diabetes is just onset very slowly. So eventually I'll stop insulin production and I will have to be on insulin for the rest of my life. Insulin is one of the things we're going to talk about today. It's something that's definitely in my routine of all of my medications. So I wanted to do this video because I wanted to show you what it takes to manage diabetes. I'm in a very unique place because with LADA, or latent autoimmune diabetes in adults, I can still take medicines that are specific for type 2 because I still have insulin production and my body still makes its own insulin. Eventually, when that's not the case anymore, I will get off of most of these medicines and I'll just be managing with insulin full time. But I am in kind of a lucky spot because I'm in an in-between where I can use these drugs that actually helps make my body more efficient and helps make my life a little bit easier. Today we're going to talk about drugs that are mostly prescribed for type 2 diabetes. Like I said, I can still use them because of my insulin production. We'll also talk about some that are pretty standard for diabetes across the board. It's important here to note that I am not your medical professional, so I cannot give you advice on what medicines to take. I can only share my own experience. So if you have questions about the medications that you're taking, please ask your doctor or your pharmacist. I cannot give you any advice about the medicines you're taking, but I can tell you what I take and I can tell you what happens when I take it. So first off, we'll start with talking about metformin. Metformin is a pretty standard issue drug when it comes to type 2 diabetes. Metformin works by reducing the amount of sugar that your liver produces in your body, and it also increases your insulin sensitivity. So if you're dealing with insulin resistance, like many people with type 2 do deal with, or PCOS, if you have PCOS, you might also be on metformin. Metformin helps to increase that insulin sensitivity, but also helps you to regulate the amount of glucose that your liver is dumping into your bloodstream. Metformin does have some awful side effects, and I have experienced them, and I have heard from lots and lots of people that it is this similar way. Metformin can cause nausea, it can cause diarrhea, stomach aches, gastrointestinal feelings of grief. It's horrible. I know when I first started taking metformin, my initial side effects were diarrhea, so badly that I had to call in sick from work. I couldn't leave my home. I had to be near, within 2 feet of a bathroom every day for the first 10 days of taking it. And then it finally got to a point where I asked my doctor, it's really making me sick and I know it helps, but I can't take this. And so they gave me an extended release form of metformin, which helps a little bit with those side effects, but you still kind of get some of those tummy rumbles and stuff. So metformin is one that I still take. I do find that it helps. For some people, it makes them lose weight. I didn't find that that was the case for me. I took metformin, but I didn't really see weight loss as an additional benefit for myself specifically, but some people do experience it. You can also take your metformin with a meal, and that tends to help with some of the stomach aches and gastrointestinal issues that you may experience. Next, we'll talk about Jardiance. So Jardiance is one of my favorite medications that I have ever taken. It personally, for me, did not give me side effects like metformin, but I noticed that it really helped in lowering my blood sugar significantly. So what's unique and interesting about Jardiance is that not only is it a blood sugar regulating medication, but it also helps to prevent cardiovascular disease and death from cardiovascular disease, which is something that people with type 2 diabetes and diabetes in general definitely definitely look for as a comorbidity, and it sometimes goes hand in hand, which is so unfortunate. So taking Jardiance can both protect your cardiovascular system, but it can also help to regulate your blood sugar. Jardiance is considered an SGLT2 inhibitor. It blocks kidney proteins that helps to reabsorb glucose back into your blood and increase glucose excretion through your urine. So basically, you end up peeing out all of the sugar instead of it going through your bloodstream. It isn't just a magic pill. You still have to do the work. So you still have to change your diet and exercise in order for Jardiance to work. But when you do make those changes, you'll notice that your blood sugars regulate really well. Jardiance does have some potential side effects that are very serious. So it's really important to work with your healthcare provider to make sure that it's right for you and that you have the ability to take it without it making a different condition worse. Next up is Atorvastatin. And I'm going to tell you this and you're going to be like, this is not a diabetes medication. However, Atorvastatin is something that I'm taking as a preventative to high cholesterol. Atorvastatin works by slowing the production of cholesterol. It helps to decrease the cholesterol that may build up in the walls of your arteries, which, as you know, when you have cholesterol, that is reducing the blood flow because it can't get through your arteries. It can be blocked in your heart, your brain, your other organs, which can lead to heart attacks, strokes, and all kinds of complications that you do not want to have to deal with. Some doctors will give Atorvastatin as a preventative so that you can just avoid altogether having to deal with any huge fluctuations or increases in your bad cholesterol, your LDL. However, it'll also be given to you as a medication if your cholesterol is high. Usually you start out at a low dose just to kind of bring things down gradually, and then you increase as it's needed. Your doctor will work with you on what's best. Next up is long-acting insulin. I personally take Tresiba as my long-acting insulin. What insulin does is help regulate the glucose in your bloodstream. When you eat a food and it has carbohydrates, those carbohydrates break down and turn into sugar in your body. Insulin helps to break down that glucose so that it doesn't enter your bloodstream and raise your blood sugar, in turn creating complications from diabetes. Insulin is the most natural way to lower your blood sugar. Most people with diabetes usually take some kind of dose of insulin. Some people can manage with diet and exercise alone, typically when it comes to type 2 diabetes. However, insulin is most commonly prescribed as a way to regulate blood sugar, and your body makes insulin if you don't have type 1 diabetes. So insulin is a natural hormone that your body is already producing. If you're insulin deficient, which is typically type 1 diabetes classified, typically you'll take insulin full time. That is going to be like your main source of being able to regulate your blood sugar. If you're type 2, insulin may be an additional supplement to what you're already doing and kind of help you be able to regulate your blood sugar more efficiently and in an easier manner than taking like a host of oral medications. For me, right now, I take 1 injection a day of my long-acting insulin. I do it at night before bed, so it covers me for the rest of the day, and it's something that's just super easy for me to do. I appreciate at this point only having to take 1 injection. I know that that will probably change in the future, but insulin is super helpful to me, and I notice really that I'm doing much better when I'm on insulin. I initially, when I was diagnosed with type 2 diabetes 4 years ago, rejected insulin and thought, I don't need to do this. I don't want to inject myself. I was really scared about it. And looking back, I wish I would have started insulin sooner because I think it would have made my blood sugars regulate a lot easier. But I also think that I gave it so much resistance because I thought that it meant that I was failing. And that's something that I want people to know about all of these medications. And if you're ever prescribed something, from the patient perspective, we can sometimes feel like we have failed and we're not doing a good job. And that's why we're being put on these medications. But these medications help us become healthier. And having to take an insulin injection or having to take an oral medication does not mean that you're a failure, and it doesn't mean that you're doing a bad job. It means your body needs a little bit of extra help to get it to where it needs to be. And if these scientifically backed medications can help you achieve that and help you achieve health and help you achieve a lack of complications, it's worth it to just try. It's worth it to start and go from there. You can always have a goal of getting off of your medications, especially if you're living with type 2. If you're living with type 1, you'll never get off of insulin. It's just not going to happen. Your body doesn't produce it, so you can't get off of it. However, for type 2, you do have the possibility to put diabetes into remission. And so with a good routine of diet, exercise, and a good combination of medications, you can eventually get your blood sugar levels to the point that they need to be. And then you can work with your doctor to scale back if that's your goal. Like I said, it's okay to take medication. Lots of us do. It doesn't mean that you're a bad person. It doesn't mean that you're lazy. It doesn't mean that you can't take care of your health. It just means that you need a little bit of help, and there are ways and resources to do that. One additional note about insulin that I want to make in this video, and that I think it's very important to share, is that insulin is not affordable. If you have a full-time job, and if that full-time job comes with insurance, and if you're able to have security in your finances, you probably have access to insulin. But if you're uninsured, if you don't have your finances in place, if you don't have the resources to be able to get what you need, insulin is out of reach for you. Insulin is a life-saving drug. It's not an option. If you take insulin, you need insulin. And right now, it's economically impossible for some people to get the insulin that they need, which results in insulin rationing, where people are not taking the full doses of the insulin that they need to be able to regulate their blood sugar. It results in death of people who can't afford to buy their insulin, and so their bodies go into shock and they end up dying from a lack of insulin in the body. And that is just unacceptable. That is not something that people should ever have to go through, especially in the United States of America. And our healthcare system needs to do something about it, because people should not die from a lack of being able to get the medications that they need to get. I'll leave some resources down in the description box below so that you can learn more about insulin affordability and how you can help with the fight for affordability. I just wanted to say that I am one of the lucky, privileged people who's able to afford insulin, and I know that it's just sheer luck. It's because, I'm a freelancer. I own my own business. My husband has a full-time job, so we're able to get insurance through his job. And the only reason that I'm able to afford insulin is because he works this job that provides really great insurance that makes my insulin relatively affordable. There have been some times where we felt like, okay, can we afford it? Like, it's getting a little expensive. It's getting a little tough, especially with this laundry list of medications that I'm talking about in this video. But for the most part, it's not as much of a worry as it is for some others. And I just wanted people to know that. And I couldn't talk about insulin without also harping on that point and making sure that people know that it's not okay that this happens and like we have to do something. The last medication that I take is another injection. It's not daily, it's weekly, and it's called Ozempic. It's classified as a GLP-1 medication. And what it does is it slows the release of food from your stomach to help with blood sugar regulation. So instead of like your food digesting like really fast and then hitting your bloodstream all at once and you getting that huge spike in your blood sugar, Ozempic tends to taper your food at a level where it helps your blood glucose kind of like regulate along the way. Additionally, if your blood sugar does spike, Ozempic has the ability to help your pancreas kind of like stimulate and use insulin more efficiently and like get more insulin into your body so that your blood sugar levels decrease. I was given the choice of taking Ozempic or doing multiple daily injections with Humalog. And ultimately, I chose Ozempic because I was very interested in the fact that Ozempic was a once-a-week shot. So instead of taking 4 or 5 injections a day plus my long-acting injection, each time that I ate, I would take 1 injection a week. I could put it on my calendar and schedule that 1 injection, and then my body would kind of like help me do the work. In addition, my endocrinologist suggested that taking Ozempic meant that my pancreas wouldn't burn out as quickly. So with LADA, you are still producing insulin. And I mentioned this earlier in the video, you're still producing low levels of insulin. And so in order to ensure that your pancreas doesn't, and I would quote unquote, burn out too fast and too soon so that you enjoy like an extended honeymoon period, basically you can take a GLP-1 like Ozempic that helps with your insulin production and helps to stimulate your pancreas in a way that doesn't necessarily burn it out. So I thought that that was interesting when I asked him, like, what are the pros and cons of doing multiple daily injections with insulin? I'm already used to it, but adding, 3 or 4 injections a day seems difficult, but then also, just doing a once weekly injection, what are the benefits? And that's what he said. And so that's what I ended up going with. I also love that my endo gave me a choice. He didn't say you have to do this or you have to do this. He said, here are 2 options for you and you choose what you think is going to be better for you. I just took my first Ozempic shot yesterday. I've heard horror stories about Ozempic that it can make you extremely nauseous and make you feel extremely sick, which was something that worried me because having gone through that with Metformin, I just didn't like feeling that way. But so far, so good. It's been like maybe 18 hours since I took my shot. I've eaten pretty normally. I didn't wake up as hungry as I normally am. Like normally I'm starving all the time and I actually wasn't that hungry. So I was like, okay, that seems like a good change. But I'm really excited to see what it does. One of the benefits is being able to lose weight a little easier, seemingly because you're not eating as much and it's lowering your appetite. I am very excited about that prospect. That's something that I really want. As you guys know, there have been many times where I've been shamed about my weight, and I try hard. I mean, I exercise, I eat well for the most part. Like I do pretty much everything that I'm supposed to do as a human being who wants to be healthy. And I take my vitamins, I drink water, like I do it all. And it's always been really hard for me to lose weight, potentially because of insulin resistance. I was diagnosed with PCOS in college. And so I have just always had these huge fluctuations in my weight, and I am like very sick of being shamed for it and very sick of thinking about it. I mentioned on Instagram the other day that overall I really like my body, but if taking Ozempic means that I can get rid of my double chin really easily, then I'm totally down for it. And sign me up. I can't wait. I will take it forever if that's the case. So that's really kind of like where I am with Ozempic. It's been, like I said, just like a handful of hours since I've taken it. So I will keep you guys updated on what it feels like if I do end up experiencing any symptoms and if overall I enjoy and like taking it. In addition to those medicines, I take vitamin D as a supplement because I was told I have a vitamin D deficiency from my doctor, and I'm also going to start going outside a lot more to get that sunlight. People with darker skin tend to have a harder time with vitamin D because darker skin doesn't absorb sunlight as much as lighter skin does. So that is something that I have to be conscious of. Additionally, I take a multivitamin just to fill in any gaps in my diet because I am sure there are gaps. So I try to make sure that that multivitamin covers everything else. All right, guys, that's it for this video today. I hope you enjoyed learning more about the medications I take to manage diabetes, as well as what they actually do. I know that that was something that I had a lot of confusion about when I was first prescribed a lot of these things. I was like, I don't even know what they actually do. Like, why am I taking all of these medications? Like, what do they actually mean. So I hope that I described them well for you. I'll leave some resources down in the description box for you if you're interested in diving any deeper. And as I mentioned before, I'm not a healthcare professional, so please consult with your doctor if you have any questions about the medications that you take, and if you want to learn more about the different treatment options that are out there for people with diabetes. I appreciate you guys watching so much. Please be sure to subscribe to my channel to get more videos when I put them out. I talk about diabetes, I talk about food, I talk about life, I do some vlogs. It's really fun around here and a super casual environment. So I hope that this was fun for you and that truly you enjoyed this. Thank you so much for watching, and I'll see you in the next one.